Good evening, everyone. Terry Maxiner here, and we are doing a video podcast for our audience. We are representing Bridge Care Consulting, and this is Bridging the Gap of Care, Senior Resources for those facing the reality of aging. As we all face the reality of aging, it is great to have experts come along to kind of help us navigate some problem areas that we might be having. As seniors, our loved ones, as ourselves that we're aging, adult children, it is so impossible to be able to know everything about everything. And so it is with an honor that I get to bring experts in that can kind of help us bridge that gap and give us information that normally I would not have. And it is so great that we have these folks that can tell us a little bit about resources that are out there that we might not typically know. So today's a video podcast. I get to welcome Tricia. And Tricia is from Inspire Senior Services. And Inspire is a great program, and I'm not going to steal a lot of Tricia's thunder about it, because this program is really devised for folks who need brain health and memory treatment. So Tricia, thank you so much for being here, and just welcome you again, because this whole dementia topic, mild, moderate, severe cognitive, people just don't know what to turn to, you know. And so I guess the first question is a little about Inspire Senior Care. It was devised from two social workers.
Well, actually, a social worker and a business person, actually a couple of business people. So the program was started in Texas, really, but one of our brain children's here in Illinois, and that's why after getting started and established in Texas, there was a real commitment to bring the program here to Illinois.
Okay.
And so that's how we got started here. And so Inspire Senior Care, our mission is to meet with individuals in retirement communities, independent living, assisted living, and memory care communities to help them optimize their functioning, optimize their quality of life, and provide brain health exercises, memory work with them to make sure that they stay as brain healthy for as long as possible.
Oh, that is great. So typically, if I wanted to refer one of my clients to you, would we have to have an underlying diagnosis, or would you be the one that could tell me, I know something's amiss here, I really think they could benefit? Because normally we can say a lot of times, they're isolated and they're not having, the social structure they should have, even though they may be living in community. So typically, what type of client are you guys looking for to service?
Well, it's an individualized treatment plan, so there is no one typical client. So all of our clients right now are in a community. So again, whether that's an independent living community or an assisted living community or even a memory care community, they are living within a structure of some kind, and that's where we're getting our referrals. I'm going in here in Illinois and doing presentations at the communities. If it's a memory care community, it might be family and powers of attorney who hear what we have to offer and sign their loved one up. Or if it's an independent living or assisted living community, the residents themselves hear the program and decide to sign up. So they can self-refer. So there does not have to be a physician diagnosis at all.
Okay, so no physician's order even prior to that. I don't have to go to my primary care physician and say, I heard about this thing, I need an order for it. You don't need that.
Not at all.
Oh, that's great. So a typical referral would be somebody who's really looking to improve their brain health, or an adult child who said, you know what, I think there's an option here, Mom, that we could really help. I worked in the arena of home health care, so we did, physical rehab, we did occupational, we did speech, but there wasn't a whole lot for that brain health. So it is really great to know that there is a place for this, and there is a modality that you guys can do that has been working very successfully, or else you wouldn't be doing what you're still doing. So that's great. So typically, what does the assessment process look like? I make a call for, one of my clients, Jane Smith, and so she agrees, and she's like, yep, have Tricia's company contact me, and then you go out and assess her.
Yeah, so what we try to do is we do try to have several folks in one community at a time who sign up, because we have individual social workers going out to the different communities, and it's really important to us and to the senior that they establish a rapport with that social worker. So we have the same social worker going into a community, and absolutely that continuity is a key piece, because that's a way for us to know if our senior is experiencing any changes too. So it's a clinical piece of it, and it's also a relationship piece of it. Perfect. Because our senior really starts to feel like a friend is coming over to visit. So if in a building we have a staff person who is collecting referrals for us, which they do in some communities, We have that client's permission to come out, that resident's permission,
Okay.
and we have a group, let's say, who are ready for us to come out. The first thing that happens is one of our social workers, our licensed clinical social workers, that's the only type of clinician that we have,
Okay.
is an LCSW, will go in, meet with the resident in his or her home, if she's comfortable with that. If they prefer to meet in a common area in the building, we can
Okay.
do that too, because some seniors are very private initially,
Yeah.
especially. So we meet where the senior will be comfortable. We do an initial assessment, takes about an hour, to get a feel for what they have going on medically, what they have going on socially, how they
Okay.
came to the community, and what they're looking for in the program. Then once we've established that it seems like it's a good fit, then we
Okay.
have our clinical psychologist come in.
Oh, wow, that is quite a bonus to have that on top of it. Okay.
Yes, for the resident and for us too as clinicians, because our psychologists will then do a cognitive test with the senior. It's
Oh,
not
okay.
painful, it takes about an hour, and again, in the privacy and comfort of their home. And once we get that baseline information about their functioning, their cognitive functioning, then we can develop our individualized treatment plan to help us go forward as clinicians with that
Okay.
resident and work with them on what they need the most help with, whether that is visual memory, whether it is executive functioning, whether it is socialization.
Okay.
We can really identify where our senior needs the most support and work with them on that. And so we want to maintain the things that are going well and improve the things that are more of a challenge.
So even if a senior is just having maybe some social issues, brand new to a community, you're already established in this community, and they're just not blending, they're just not getting involved. They're still probably grieving their previous situation of leaving home, and I think that the integration piece into a community is where I think your service would just be unbelievable of value, because I was laughing with a friend of mine who does marketing, and she said, we still yet to have to find a senior that hasn't left too many skid marks in the parking lot when moving into their community.
Yes.
You know, as much as we know overall it's a great decision, but it's great to know that Inspire is there to kind of help that integration process. I know the biggest thing that people are going to wonder too is who pays for this?
Well, this is the piece that a lot of people cannot believe. Medicare Part B pays for this.
Wow, so I can have something Medicare A going on in my life in the same time
Yes.
with home health care. Okay.
Absolutely. So we do not interfere with a home health care benefit whatsoever. As long as a senior has Medicare Part B, there is no out-of-pocket expense. And we do actually also work with some other managed Medicare programs, but
Okay.
there are so many, and that's not my area of expertise, that we will work with a senior regarding their insurance, get it verified.
Right.
And make sure that benefits are verified before we start any services, so the senior does not have to worry. And Medicare sends them an explanation of benefits, so they do get a report from Medicare that shows our clinician has been out to see them, and
Yeah,
yes.
so there, so the checklist is there,
Yeah.
and what a great thing for the adult child. It might not be, how many times did she come and visit, or how many
Right.
times that, no, mom, so-and-so was there so many times last month. That is great. So where would, if we wanted to introduce you into a community, just basically contacting you?
Yes.
Okay, because there's communities out there, and I know there's folks that are always listening to our podcast, brand new out here. I mean, we've got, 2 to 3 that I can think of off the top of my head that I don't even know if they're aware that Inspire can be into their community to help out with that brain health and just, that whole memory piece, whether or not someone wants to still being able to maintain their checkbook, or they're just worried about some social issues.
Absolutely, and socialization has been shown to prevent some of the aspects of dementia from creeping in sooner. So
Amen.
socialization is a huge part
Yes.
of what we want to do. And again, getting to know our residents is a key piece of that. And I know I said it before, but I'll say it again. Our residents really start to feel like it's a friend coming over. It's that ability for us to come in and provide them with, even our dementia clients
Right.
who might be a little further along or in memory care.
Right.
Having that socialization, even with their clinician twice a week, is such a relief and such a comfort to families.
Right. And then is there, since you're in already like a community, is there communication between you and any of the staff in the community too, so they can kind of pick up, and I just look at this as like maybe a client was with you for a while and they've had some of a change or a decline to get services back in, and that is allowable.
Absolutely, as long as we have consent signed, which is very
Okay.
important to us. We're going to maintain the resident's privacy. But if we can get a consent signed from the resident, that we can share information and assuring them the goal is always to, make sure every decision is made with their best interest in mind. We're trying to keep them
Absolutely.
safe, we're trying to keep them healthy, and
Right.
all the members of their care team have that goal.
Yep.
And so we would absolutely be working with powers of attorney if a resident isn't able to make decisions for themselves.
Perfect.
Or with staff if we need that key piece of information regarding medication, or we do see a decline. We do see
Right.
that Jane Smith is not as chipper as she normally is, or
Right.
she hasn't been going to her social activities. If we don't already have consent from Jane, we will request it so that we can speak to the staff openly about what our concerns are, what we're
Perfect.
observing, and likewise that they can inform us
Right.
of anything that might have happened
And
in their lives.
Then the right hand knows what the left hand is doing.
Absolutely.
So that is
Yes.
great. Well, I can't thank you enough, Tricia. If you have any questions for Tricia, she can be emailed at tricia@inspireseniorcare.com. So again, Inspire Senior Care is available for independent living buildings, assisted memory supported living buildings, and it is really an opportunity to maintain brain health for our folks. So I thank you again for joining us on this podcast, Bridging the Gap of Care, Resources for Those Facing the Reality of Aging.